Hello and welcome. On behalf of CME Outfitters, I would like to welcome all of you and thank you for joining us for the second in a series of 3 snacks titled Why the Spread of Dengue Matters and Current Unmet Needs for Dengue Prevention. This CMEO snack series is supported by an independent medical education grant from Takeda Pharmaceuticals in US. My name is Marco Aurelio Safadi. I'm an associate professor and currently I'm the head of the Department of Pediatrics at Santa Casa de São Paulo School of Medical Sciences in Brazil. And I have the pleasure to be joined today by my distinguished colleague, Dr. Inês Esquilin Rivera. Dr. Rivera, could you please introduce yourself?
Hi, Dr. Safadi. My name is Inês Esquilin. I'm a professor at the Department of Pediatrics of the University of Puerto Rico School of Medicine. And I'm also the director of the Pediatric Infectious Diseases Division at the school.
Okay, thank you, Inês. To frame the discussion today, let me review our learning objective. Our goal today is that after this CME snack, you will be able to evaluate the importance of dengue vaccination, factoring current unmet needs associated with the vaccination. In our last program, we talked a little bit about what dengue is and its presence in the US. Dr. Inês, could you do a very brief review of the situation of dengue in US currently?
Yes, dengue infection is endemic in Puerto Rico and the Caribbean and other parts of the world, but not in the US. But there have been local transmission of the virus in the states of Hawaii, Florida, Texas, and Arizona. So there is travel-associated disease and local transmission in certain parts of the US too. By 2080, it is projected that the areas at risk of dengue in the US will cover most of the southeast parts of the US.
Okay, excellent. Well, knowing what is the current situation of dengue in US, let me know which are the current tools in terms of vaccination that you do have in US to prevent dengue.
Yes, there is a vaccine, which is Dengvaxia CYD-TDV, that was approved by the FDA in 2019 and recommended by the ACIP in 2021. But there are some limitations with the use of the vaccine that we can discuss in detail, and it has been probably related to the age indication, the requirement of a documentation of a previous dengue infection for those that will receive the vaccine, and the access to the vaccine.
Okay, thank you for this summary. So let's go into more details in some of the, let's say, challenges we currently have in US with the current vaccine options. Could you expand a little bit on this challenge that you see for dengue prevention with the current vaccine that is available in US, Inês?
Yes, this vaccine was approved for individuals from 9 years through 16 years of age. And there are age-related concerns, specifically because 50% of the dengue cases in Puerto Rico are documented to be in people greater than 20 years of age. These are the cases that are reported to the health department. We think that there is much more dengue in the little ones, in children, especially in infants, because they could present with a non-specific febrile illness, but for those that get tested for dengue, it's mostly in those more than 20 years of age. And then the major number of deaths associated to dengue is in those greater than 20 years too. And we know that dengue can cause severe disease. So one of the major concerns is the question if all people at risk should be protected by a vaccine. Then, apart from the age, the other indication related concerns, because it is approved only for people in endemic region, and that applies for Puerto Rico, but not for people that travel to Puerto Rico and to other areas that are endemic. For travelers, there is no vaccine at present approved by the FDA.
Okay, no, definitely having a major burden of disease outside the age groups where the vaccine is currently licensed in US is definitely an important limitation. But we have other points that we should also discuss, Inés. And one important point is the need of having previous laboratory confirmed infection before vaccinating a patient with CID TDV. Could you comment on this, on the need of having those patients with a confirmed previous infection with dengue before considering the vaccine?
Yes, it is very important that if a person is going to receive the dengue vaccine, there is laboratory confirmed evidence of previous dengue infection. And this recommendation comes from the clinical study data that showed that participants of the clinical trials and people that received the vaccine without prior evidence of infection had a higher risk of severe disease. So in order for individuals to get the vaccine, they should have evidence of a PCR test positive for dengue or an NS1 antigen test result. If those are not available, they should get tested and they should have 2 different IgG tests done. The NS1 type 1 to 4 ELISA IgG and a rapid test. And then only children with positive IgG to both tests are considered eligible for vaccination with the CYB vaccine. If you consider other tests in order to document prior infection, the immunoglobulin, the IgM test is not sufficient proof of dengue virus infection because there can be cross-reactivity with other circulating viruses like the Zika virus, which was very prevalent in Puerto Rico and other countries from 2016, and most of the population was exposed to Zika.
Okay, excellent. Definitely no doubts that having the need of accessing the status of previous infection in those patients with lab tests clearly is a limitation to really use the vaccine. But could you expand a little bit on why this information is really needed? What is behind the risk of administering this CID TDV to a person that is naive to dengue?
Sure. As we all know, dengue is caused by 4 serotypes of the dengue virus. So people can get infected with dengue up to 4 times in their lifetime. The risk of severe dengue and hospitalization is highest after the second exposure. So patients may have dengue, but if they get infection by a second serotype, the risk of severe disease is higher. So it's very important to make sure that if the patient has documentation of a prior dengue infection. And why this occurs? Well, it has been postulated that if you get exposed to dengue and infected with the virus, you can develop antibodies, or maybe these antibodies are not able to neutralize completely the second virus when you get that second infection, and that lack of complete neutralization of the infection will make viral replication higher, and probably the patient will become more symptomatic and have a more severe disease.
Oh, this is very intriguing. It's very unique, this situation. I think dengue is the only disease where theoretically the high risk of having a severe presentation of disease is associated with the secondary infection, and these non-neutralizing antibodies against the heterotypic serotype appears to be the most probable justification to see those theoretically severe presentations during secondary infection. And it's also intriguing, Inés, that the tertiary and quaternary infections, they are usually not associated with the same risk to have severe presentation as the secondary infection. So the secondary infection is really the one that is associated with the higher risk of having those severe presentations. But let me move now to another topic, Inés. We talked a little bit about prevention with vaccine, prevention of dengue with vaccine. But what about vector control? Do you have some comments on which are the initiatives that we currently have to prevent dengue using vector control?
Yeah, vector control is very important. And in places like Puerto Rico, where we have sometimes the 4 serotypes circulating, or 3 of them mostly, the campaigns to control the vector are very important. Insecticides, larvicides are also used, but those are not as effective having a good source control of the mosquito. And it's very, very important. People have to get aware of the importance of looking in their backyards and trying to control the mosquitoes in the community. The other methods that we always emphasize to our patients are the repellents. We use DEET repellents, picaridin repellents, oil of lemon and eucalyptus repellents, and those are effective, but just for a short time. They depend on reapplication of the repellent, like every 2 or 3 hours, in order for those to be effective. There are some that can be applied to the clothing, and those are good too, but again, we have to keep applying the repellent. We emphasize also the importance of mosquito nets. They're not used as we used to do in the past. Those will create a barrier between the mosquitoes and the patient and decrease the risk of transmission. Those are important too, but not used as before. So in general, that's why the development of the vaccines is so important, because all other methods that have been tried have not been as effective as we would have wanted in controlling the mosquito and the transmission.
Yeah, you are perfectly right. We have really failed to really control the vector, the Aedes mosquitoes. But I must say that these new methods that are being tested in several regions, and actually in Brazil, we are testing some of these methods like the Wolbachia and the genetic modification, mosquitoes, etc., appears to be very promising. I'm really look forward to see the results in the long term of these initiatives, because I think that they may play an important role to really control the vector and to decrease the burden associated with dengue. But Inés, let's finish our program today with some real-world discussion regarding topics related to unmet needs in the prevention of dengue. And the first one that I think it's an important point to be discussed, and how is it going in your place, in your region, in your country, the administration of the currently vaccine? Do you see a good coverage? Are persons really having the possibility of administering the vaccine in your region, in your country? What can you tell us about this?
Well, the Puerto Rico Health Department is making a great effort in trying to make the vaccine available to children and adolescents with a 9 to 16-year-old indication of the FDA approved vaccine. It was endorsed by the CIP in 2021. It was approved by the Vaccines for Children program, which makes it available to most of the population in the area. But there are some challenges in the process of getting these children vaccinated. It's the logistics of the administration of the vaccine that we have to work on, because this is not a one-stop service offer. The patient has to come to the pediatrician, needs to get the order for the lab test, has to go to the lab and get the blood drawn, and the results have to be available to the pediatrician to order the vaccine. And this is a 3-dose vaccine series. So we have some children already that have been going through the process, but it has been a little bit difficult. Actually, the complexity, the logistics is what is making it go slowly and not as fast as we would like.
Yeah, just to let you know, in Brazil, we have the vaccine also licensed, and it's licensed in a wider age group. Here in Brazil, the vaccine is licensed from 6 to 45 years of age. But despite this fact, the vaccine was really it's being used very limited use currently. It's only in the private sector. It's not included as a recommended vaccine in the national immunization program. So persons only have the vaccine in private clinics. And definitely the deployment has been very limited in our population. And obviously the need of testing those subjects before administering the vaccine is a clear limitation. But I'm also curious to know from you in your region and also in the places where the vaccine is licensed in the US, what is the perception of the parents, of the families of the vaccine? How do they see the role of the vaccine? I mean, the parents' perspective.
Well, when you talk to the parents about the vaccine, there is a lack of knowledge about this vaccine and how important it is to get their kids vaccinated. People know about dengue. People have friends, family members that have been in the hospital or even died of dengue. So they are very aware of what dengue is and what it can cause. But in terms of education about the vaccine, we have been lacking campaigns to educate the community, especially the parents, about the vaccine. And then we had the COVID pandemic, and all the misconceptions with the COVID vaccine. And I think that probably this has made it more difficult to have an open discussion with the parents about the new vaccine and how important it is.
Okay, and last 2 points that I would like to hear from you. The first one is regarding physicians in US in general. Are they familiar with the vaccine? Are they really willing to administer the vaccine to individuals in their respective areas?
In terms of the physicians, when we look at their knowledge about the vaccine, and this was done prior to the ACIP endorsement of the vaccine in 2021, we found there was a lack of knowledge about this vaccine. Even when it was approved at the FDA in 2019, pediatricians were not aware of the vaccine, were not aware that it was available for and was recommended. So we have to work a lot in getting them oriented and educated about the benefits of the vaccine.
Okay, perfect. And the last point, I think very challenging, is the travelers issue. So when you have a person that has a plan to visit an endemic area and wants to be protected before going, so this is currently a limitation because we do not have the possibility of really addressing the vaccine in a deployed way for those persons. So could you comment a bit on the limitations also to have this vaccine as a vaccine to protect travelers that intend to visit endemic areas?
Yeah, well, the travelers will be at risk. You can assume that if we are able to establish a good vaccine program, and at least the adolescents get the vaccines, which is the indication, there will be less dengue virus circulating in the community, and the risk for the travelers will be less. But so far, they are at risk. There are at least 3 of the 4 serotypes are circulating in Puerto Rico right now. So, and then we'll bring the virus to their communities where the vectors are circulating. And that's why there is local transmission in states like Florida, Arizona, Texas, because these travelers are susceptible and the virus is circulating, so they will bring the infection to their communities. I think that the travelers are an important group that should be considered for vaccination in the future.
Yeah, currently the only option that we have for travelers is really to address important points regarding how to be protected against the vector when they are traveling to high-risk areas, and we hope to have vaccine options that could be used for those individuals in the future. Okay, thank you so much, Dr. Escolin Rivera, for this wonderful program. I hope our audience has learned a lot about a topic that they be not familiar with in the US. Let's go over our SMART goals that we hope our audience has accomplished from participating in this program. The first point is to characterize unmet needs related to dengue vaccination in the United States, specifically related to indication, to age groups where the vaccine may be used, testing requirements, and also access barriers. The second point is to utilize scientific knowledge related to dengue vaccination and also the ADE issue, the antibody-dependent enhancement, when determining patient eligibility for the available dengue vaccines. And last but not least, apply real-world data in terms of perspectives and knowledge of dengue vaccination to share decision-making conversations with the eligible candidates for the available dengue vaccines. Well, this CMEO snack is one of a three-part series. We hope that you will take advantage of all of the short and focused activities in the series. Thank you again, Dr. Esquilin Rivera, for joining me today, and thank you all to our audience for participating and providing the best care for your patients. Thank you so much.